As the limitations of aspirin become increasingly evident, particularly its bleeding risk and reduced effectiveness in certain patients, clopidogrel is emerging as a promising alternative. For decades, aspirin has been the go-to drug for preventing heart attacks and strokes. But recent research is turning that assumption on its head. Aspirin has been overtaken by another well-known medication, which is essentially a blood thinner and may be even more beneficial, according to an exciting new study from the European Society of Cardiology Congress that was published in The Lancet. Doctors now believe that clopidogrel, a well-known antiplatelet medication, could be more effective than aspirin for long-term prevention of heart attacks, especially in those at high risk. More importantly, it might carry no added risk of serious bleeding, which has always been a lingering concern with blood-thinning medications. Researchers provided a thorough review of 7 clinical studies involving around 29,000 patients with coronary artery disease at the European Society of Cardiology Congress. According to the results, clopidogrel was 14 more effective than aspirin at lowering the risk of major cardiovascular events. This advantage was widespread and extended to people who might react less favorably to clopidogrel because of clinical or genetic reasons. Importantly, there was no significant difference in the risk of bleeding between the clopidogrel and aspirin groups. Experts say that because of clopidogrel's low cost, broad availability, and now established effectiveness, these findings may change international treatment recommendations. Clopidogrel belongs to a class called P2Y2 inhibitors. These drugs target and block platelet receptors more effectively, thereby preventing the formation of dangerous blood clots in the arteries. While aspirin has long stood as a simple and affordable prescription, clopidogrel may just offer better protection without trading off safety. Despite these exciting findings, doctors emphasize that you should not switch your medication without consulting your healthcare provider. Every patient has a unique medical history, and only a trained professional can decide which therapy suits you best. Better outcomes without sacrificing safety. If clopidogrel truly offers superior protection against heart attacks without increasing the risk of bleeding, this could improve both the quality of life and survival rates for many patients. A shift in treatment norms. Aspirin has long been the default for long-term heart protection. These findings could spark updates in medical protocols around the world, potentially replacing aspirin with clopidogrel in certain cases. Accessible and effective clopidogrel is widely available and affordable, making it a viable option for many, particularly in areas where healthcare budgets are limited. However, experts stress that individual assessments remain crucial. This isn't a blanket recommendation. Disclaimer: tips and suggestions mentioned in the article are for general information purposes only and should not be construed as professional medical advice. Always consult your doctor or a dietitian before starting any fitness program or making any changes to your diet. Also read: Fitness Expert explains how to use creatine safely and effectively and why.